Hello everyone, welcome to Dentospedia, a platform designed to simplify dentistry and support the students preparing for various global dental board exams. Our goal is to make every student make the topic clear and clinically relevant and easy to understand no matter what stage of learning you are at. So today I am going to give you a short lecture from endodontic module, that is the diseases of the pulp. So let us begin with the chapter. So to understand the pulpal diseases, it helps us to answer big three clinical question. That is the pulp is healthy or it is inflamed? If the inflammation is still reversible or it is irreversible, do we save the pulp or perform root canal treatment? This chapter gives you a foundation to diagnose the tooth and the pain correctly and select the right treatment and prevent unnecessary root canal. So introduction to the pulp. The dental pulp is a formative organ. So dental pulp is a formative organ of the tooth, and we have studied this in very detail in the first chapter. This dental pulp, it forms the dentine, that is the primary dentine during development, that is before eruption, secondary dentine after the eruption, or reparative dentine, which is also known as tertiary dentine when stimulated, that is in the case of injury or any case of trauma. So in case of injury and a trauma, reparative dentine is formed. This dental pulp has odontoblast cells which forms this dentine. The pulp resistance to injury varies and it depends on the age, its nutrition supply, cellular activity and physiology. But there is poor correlation between the symptoms and the actual history. There might be no symptom, the tooth might be showing symptoms, but the actual histology might be different. So it is very important to come to an accurate pulp diagnosis and is essential for successful endodontic treatment. Coming to the causes of the pulp disease, the causes are grouped into three major categories, that is a physical cause, chemical cause or bacterial cause, in which the bacterial cause is the most common cause. These bacteria through the dentinal caries, they enter into the pulp. Coming to clinical classification of these pulpitis, the term pulpitis means it is the inflammation of the pulp. I hope you understand that. Inflammatory diseases in which there is reversible pulpitis, irreversible pulpitis, symptomatic, asymptomatic, hyperplastic chronic, or internal resorption. While there is pulp degeneration or calcification, and lastly there is pulp necrosis, that is the pulp death. So let us see the sequence or the sequelae of these pulp diseases. So the normal pulp, due to any obnoxious stimuli causing the inflammation, the normal pulp may change to reversible pulpitis, but it is still reversible. That means it can go back to normal pulp. Then when further progresses to the later stages, then reversible pulpitis may change to irreversible pulpitis. Now irreversible pulpitis may go to four different stages, that is chronic hyperplastic pulpitis, symptomatic irreversible pulpitis, asymptomatic irreversible pulpitis, and internal resorption. So irreversible pulpitis, that means it cannot go back to the normal pulp. It cannot go back to the normal pulp, and this irreversible pulpitis may be symptomatic, may be asymptomatic. Depending on any stage, it might go to internal resorption or chronic hyperplastic pulpitis. But all of this may further progresses to pulp necrosis. A normal pulp can directly go to pulp necrosis due to any case of traumatic injury. In case of traumatic injury, the ischemia induced by this traumatic injury. What is ischemia? Ischemia is the loss of blood supply. That is to reduce blood supply. There is minimal blood supply which causes this normal pulp to go to pulp necrosis. While any stimuli which causes any degenerative changes in the pulp, which causes calcific degeneration and calcific metamorphosis, and we are going to discuss each and every diseases in very detail. So thank you everyone. Thank you for your cooperation. To learn this entire chapter in detail with flowcharts, diagrams and case-based explanation and exams MCQs, download the Dentospedia app today and start mastering the endodontics with clearly and confidently. Thank you.